Hi friends, welcome all of you to the class of thyroid disease. If you have watched my last video about adrenal disease, you must have seen a flow chart that would be helpful greatly whenever you want to study any endocrine diseases so that you will get to know the whole process behind this. So let's start with the thyroid disease. Today we will discuss about hyper and hypothyroidism. First of all, we have to understand that both are like a mirror images. That means their symptoms are just exact opposite to each other. When we talk about hyperthyroidism, this is called as the excess production of thyroid hormone. This the hyperthyroidism is also known as Graves' disease. So whenever there is an excess production of thyroid hormone, patient may feel hot always when others are cool. You can remember, like when we hear about the word hyper means high metabolism. So when the patient is having high metabolism, they may feel hot. So you can remember like this. So patient is hot when others are cool. And the other symptom is they will be hungry and eating all the time, but they lose the weight. Then thinning of hair, fine tremor, tachycardia, these all are the symptoms of hyperthyroidism. Then one of the classic feature of hyperthyroidism is the stare with the proptosis. This is caused by deposition of glycosaminoglycans in orbital musculature. Then the other feature is that they may often feel periorbital edema. Then thyroid gland is diffusely enlarged and smooth. These all are the major symptoms of hyperthyroidism. And the rare complication is the Graves' dermopathy or pretibial myxedema. You know what is pretibial myxedema? This is the asymmetric or symmetric pitting edema of anterior and lateral aspect of the lower leg. Then increase in size of the middle pyramidal lobe of the gland can also be seen as a rare complication. Then we will discuss about the oral manifestation. Then what will happen is that exacerbate the patient response to dental pain and anxiety for such patients. Then change in the oculomotor function, protrusion of eyes. You must have seen my thumbnail that the protruded eyes of a patient. So you can see the protrusion of eyes. That is because of this reason we call this disease as a Graves' disease. Then excess sweating, enlarged thyroid or tongue, difficulty in swallowing, all are the oral manifestation of hyperthyroidism. Then how we will manage them in the dental clinic? So that is really important. Whenever a hyperthyroid patient come to our clinic, we need to be very careful with the risk of development of thyrotoxicosis or a thyroid storm. So what is this thyroid storm? They may feel extreme irritability and delirium, and it can lead to hypotension. Then vomiting and diarrhea can also be seen. So these all can be triggered by a surgery, sepsis, trauma, or any treatment like this. So elective dental care is really important. Then the other thing is the stress management. They'll be having lot of stress because as a part of this disease. So we need to be very gentle with them, and the short appointments has to be given. And whenever they are not comfortable with the treatment, you need to immediately stop the treatment and send them. So we have to manage stress like that. Then these hyperthyroid patients are highly susceptible to cardiovascular disease, so consult with the physician. Then the other important point is that we need to familiar with patients' current medication, because the drugs used for hyperthyroidism are susceptible to infection. They also cause cyalolith formation, and that can increase the anticoagulant effects of warfarin. Then so that you need to be careful with the medication. Moreover, certain analgesic must be used in caution. Then when we give aspirin and NSAIDs, we have to be careful. These increase the T4 level and can lead to thyrotoxicosis. Then the use of epinephrine and other sympathomimetics need special consideration when treating these hypothyroid patients and those taking non-selective beta blockers. What will happen is that this epinephrine, this act on the alpha adrenergic receptors, and that can lead to the vasoconstriction. Then when they act on beta receptors, that can cause vasodilation. So give treatment according to that. So these are all about the dental management of hyperthyroidism. Then next is the hypothyroidism. As I told you, no, this is the just opposite of the hyperthyroid patients, the symptoms. So in hyperthyroid patients, they had what hot, they may feel hot always, but in this disease they feel cold. When others are comfortable, at that time they feel cold, and they are chronically fatigued and gaining weight. Without eating more, they gain lot of weight and they get constipated, bradycardia with slowed reflexes. So their metabolic rate are very less. So these kind of symptoms are there for hyperthyroid patients. When as the disease progress, they can feel this mental slowing, depression and hypothermia. Then the major cause of this hypothyroidism is the autoimmune destruction of the gland, that is called as Hashimoto's thyroiditis. Then also the loss of TSH producing cells of pituitary gland. Then what is the oral manifestation? The important feature of hypothyroid patient is the facial myxedema is the main feature. Then this the childhood hypothyroidism is known as cretinism. So in such patients, their features will be macroglossia and malocclusion, and compromised periodontal health and delayed tooth eruption. These are all the features of a cretinism patient. So this delayed tooth eruption is really important. You have to remember this, because in my last video I explained about cleidocranial dysplasia and intracranial dysplasia. There also a lot of symptoms which are related to this. So you need to be you need to remember this point, because many questions have asked based on this and you may get confused. Then the other symptom is the delayed wound healing, because their metabolic activity is very less, so the wound healing will be delayed. Then hoarse voice and salivary gland enlargement and changes in taste and burning mouth syndrome, all that can be seen in this kind of patients. Then the other is the dental management, how to treat them in the clinic. They may feel lethargy due to the increased respiratory rate and increased risk of aspiration of dental materials. So you need to be careful. You need to assess properly how they feel and how they behave. The next is these patients are susceptible to cardiovascular diseases, as I told you, the same in the hyperthyroid patients also. So consultation with the medical providers are important. Due to this delayed wound healing, you need to do the coagulation test, that is also required. So these are all about hyper and hypothyroidism.